Hello, my name is Christine. I'm with Disability Action Center in collaboration with Alternatives to Violence of the Blues. Today we're going to talk about medical self-advocacy. This is the last workshop we've got, so make sure to check out our other workshops on boundaries and on sex and sexuality. So let's get started. Medical self-advocacy just means you're able to advocate for yourself in medical settings, meaning that you can communicate your opinions and your needs in a confident manner. You establish yourself as the prime decider of your medical care. So we'll go over what makes up medical self-advocacy and how you can practice advocating for yourself. This entails being assertive, building knowledge, taking an active role, and expanding your circle. These are sort of the major elements that we'll go over and explain more in depth. First, being assertive, this means you're making your opinion clear while still being respectful. When you assert an opinion, you're communicating directly what you want and why. We have some examples. One of them is an assertive statement, and the other two are either aggressive or passive. Sometimes it can be hard to not be passive in a medical setting because you don't want to seem difficult, but being assertive shouldn't be taken as being difficult. Being assertive in medical settings shows that you know the value of your opinion and that you're invested in your care. Another aspect of self-advocacy is knowing what you're talking about. So building knowledge and knowing your rights when it comes to your medical care. When you know what legal protections you have, either as a patient under the AMA or as a person with a disability under the ADA, you're able to make better, more informed arguments for your case, or just more informed decisions when it comes to your medical care. It can also help you recognize if your rights are being violated or if you're being discriminated against or taken advantage of. So here are some AMA patient rights. That's the American Medical Association's patient rights. These are pretty simplified, so if you want a more in-depth version, you can Google ama-assn.org and click on their medical ethics tab. This next slide is a short blurb about your rights under HIPAA, specifically under the privacy rule. So this would be regarding the confidentiality of your medical records and other sensitive medical information. And there is a URL to where this came from if you're wanting to read more into it. These are just two examples of the kinds of things you might want to be aware of when it comes to your legal rights and your protections. Upon conducting some more research, I'm sure you'll find a lot more, and it tends to be specific to you. Taking an active role is our next topic. This is sort of building on the first two of being assertive and of being informed. It's just putting it into action. So this would entail showing up to your appointments with a list of concerns, dates of onset, questions for your providers. So you could use a symptom tracker for those first 2 points, and we'll go over actually how to make, that's the activity, so we'll go over how to make one of those. Taking notes during your appointment or having a support person who can do that for you. Your provider is able to give you infographics or printouts of helpful info regarding your care, request some. And then research your diagnoses using reputable sources, of course. If you find something online that sounds concerning or that you're wanting to look into more, bring it to your provider, but always make sure that you're looping in your provider on decisions that you're making outside of appointments. Make sure that you know how to access your records and keep up-to-date records of your vaccinations and your checkups printed out that can be readily available. Lastly, you'll want to expand your circles. So these are your circle of care and your circle of opinion. Your circle of care, when you're expanding that, just means that you're using all of the resources at your disposal to get as much help as you can that you need. Maybe this means adding to the providers that you already see, like adding a physical therapist or an acupuncturist, or seeking things outside of the doctor's office that would help benefit your treatment in other ways, like going to a support club or joining a support group or joining a run club. The goal being that you're not relying on one provider for every need and that you're invested in your health outside of the doctor's office. Expanding your circle of opinion can be consulting with other people, either professionals or people that you trust, people that have lived experience about your care options. Sometimes if we're confused or if we're at a crossroads, it can be nice to hear other opinions or perspectives. So that's kind of the goal of that. We'll move on to a small activity. This is, like I said, creating that symptom tracker. To make it, this one is weekly, by the way, so it's not going to last super long, and you might have to keep printing them out or keep making them. There are monthly versions available, but to keep it simple right now, we'll just do a weekly version. So you're going to take a piece of paper, you're going to write symptom on the top left side of the page, and then the days of the week, Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, on the top right. Under symptom, write the symptoms you find you experience most often, or common symptoms that you might need to be concerned about in the future in a vertical list. So this can be like headache, back pain, toothache, things like that. Next to the list, under the days of the week, make one box under each day, then add more boxes under each box vertically for however many symptoms you have listed. So here's what it might look like. And again, choose any symptoms that you want, anything that you want to keep track of or you think might be a concern in the future. And we'll end on some resources. There's one URL for patientadvocate.org, which provides case management services, and they also have some financial aid programs. And then DACNW, that's us. Or if you're not in our service area, you can find your local Center for Independent Living. Independent living advocates at CILs can support you in feeling more confident and assertive, and can also inform you of your rights under the ADA. Also atvp.org, advocacy services and support groups, and then LRC or Latah Recovery Center.org. This is for the Latah service area, which provides support for substance use disorder and mental health. Make sure to check out the other 2 workshops again for more information, and thanks so much for watching. Bye-bye.